when sports and exercise medicine became a specialty. It was part of the Olympic bid. So when the Olympic bid went in for London 2012 in 2005, the part of the bid was to build much more of a sports medicine support network to encourage a healthier nation. I have worked with a number of elite international teams, and my passion is that everybody will be entitled to the same level of medical care that those international players and elite athletes get. So I'm really passionate about giving that to everybody. The weekend warrior, anybody's interested in starting some exercise or starting some sport to improve their fitness, very, very keen to help them with that. So not only do we help with the injuries that they suffer, but we also are really keen on helping them to promote health and to prevent injuries if we possibly can. That's why I like it and passionate about it so much, is because it covers the real holistic way of managing a patient, not just the injury they've come with a sore ankle. Is that sore ankle due to a foot problem, a knee problem, or a hip problem? And if they do, is it related to their training regime? Are they just doing the wrong type of training? Are they running on the wrong side of the road, so they're always running on the wrong camber? What are their shoes like? What's good for them, and assess their gait and assess how their movement patterns. So it's a huge area, but very rewarding when things go well. And as I said before, if I can provide for anybody walking through the door at Circle the care that we provide at the international and elite level, then I know that I'm doing my job. So I had somebody recently who had pain in the back of in their groin, and radiating around and spreading around to the back of their thigh. And they were a weekend jogger. They were looking to do, to take part in an event or to run for a charity, but their training program was restricted. Their running training was restricted by this pain, this vague pain in their groin. So, groin pain's a fascinating area. There are so many different areas of the body that can produce pain in the groin. So first of all, you've got to rule out possibility of the back causing the problem. Then you've got to see, is it from the hip joint itself, or is it coming more from the abdominal muscles? Is it coming from the posterior muscles, the hamstrings, or is it the quads, the groin muscles, or is it a hernia? So there's so many different things that can cause that. So the first thing they do is come through, take the history, find out how, what's causing the problem, what makes it worse, how it's affecting their lifestyle, their work. Even if they're just people who just want to walk to work to increase their exercise, what's it limiting them doing? But also you want to find out what they enjoy doing. It's very difficult when somebody wants to start an exercise or start getting fitter. What do they enjoy doing? Well, you could tell somebody to go swimming. Well, if they don't like swimming, there's no point in expressing that, because patients are going to switch off, and understandably so. I know I would. So you try and find out what interests them, what they could do, and what they could build into their busy, hectic lives. So this lady came in with this groin pain. She was a recreational runner. She was actually wanting to join a running club, and somebody suggested because of her height, she should consider hurdles. So she had a go, and that's when she started to get the pain in her groin. So we had a look at her, went through the standard history to do. We asked her about her footwear and the training that she's doing, and it pretty much came apparent that she'd moved from doing sort of long distance, relatively long distance for her, into a sprint pattern and the sprint hurdling, and she was finding that really difficult. And as we examined her, found out that really her core stability was really weak, more so on that side, and the pain was coming more from the tightness she was having in her hip flexors. And it was being referred, and she'd actually had strained the ultimate end of this episode was she'd actually strained her the hamstring at the origin of where it comes off the bone. So she'd had a significant injury in the hamstring, but that was a result of poor biomechanics related to groin in the pelvis and the type of running she was going to do, that twisting the pelvis when you go on the hurdles. So we had to first of all manage the hamstring, because that was the bit that really was the acute thing, is why she came to see me. So then it's a case of really assessing the hamstring, how strong it is, and what we can do to really build up muscle length. First of all, first area of rehab, sort of 4 stages. I like to think of the 4 stages of rehab. First stage is get the pain down, get the swelling down, make the patient comfortable. Second stage is getting that muscle out to length, so with the hamstring, making sure that the leg movements, the straight leg movements, are going to be comfortable for her as she moves to the end range. So she's really stretching out the hamstring and is pain-free. Once you got to that stage, we then start to look at muscle strength. And we've got particularly a machine at Circle, which is an isokinetic machine, which we can look at how the hamstring relates to the quadriceps. So both those muscles work together to move the knee, but also have an effect on moving the hip. So we want to see the ratio of those, and so we can really then fine-tune her program to which part of the hamstring we really need to get strong. So we've built that up, we've got her stronger, keep assessing how she's doing, and then gradually then building to stage 3, which is putting all those individual muscle strengths at the end of stage 3 to move into stage 4, which is the sport-specific or the exercise-specific program. So then we're trying to build her up into her running regime, making sure that she can start on intervals, simple jog first, just going straight line running on the flat, no curve in the road, no camber in the road to offset her balance. Whilst all the way through these stages, maintaining the cardiovascular status, her cardio fitness as best we can. Now, clearly, when you've got a leg problem, it's going to be difficult to go and do any running, or you can't go on a treadmill, you can't go on a cross trainer. But you could do a bit of cycling, and you can look at cycling. Do you enjoy doing cycling? Well, not really. Well, okay, how about swimming? Well, yeah, swimming's good. So again, you can do some cardio with the swimming without risk of making the injury any worse. So it's building that program, the CV, the cardio training through, so they don't lose any fitness, particularly if they're training, they haven't done much, and they're training for a 10K or 5K charity run. You don't want to lose all the stuff you've done before. So it's really being positive with them, and getting the patient to really see the benefits of what you're doing, so they can do those exercises, do those strength work, and then at the end of the day they can see some light at the tunnel when you put it all together, and then they go and then they break their record at the 10K, and that's then we know we've done our job. The diagnostic equipment we can use at Circle for assessing injuries, sports injuries. We have gait analysis, where we can just video how the patient walks, or even how the patient runs, seeing what the heel strike like, the foot strike, because it's so important for the whole of the chain from the foot all the way up to the back. If you get that wrong, if the biomechanics are altered for whatever reason, it could be a stiff ankle or it could be a sore groin, for whatever reason, then you can adjust those patterns to ensure that the running gait or the walking style is optimum for that particular patient. We also have the ability to train people at altitude. For those, we've used that for most recently. I was involved training this elite cyclist who was going to cycle from the bottom of Argentina all the way top to Alaska trying to break the world record. And we put him on altitude training on the altitude machine, and it was quite interesting to see how he responded. He was great up to the first sort of 6,000-7,000 feet, but after that he struggled a little bit. So we could then tailor his training to really focus on those higher distances, so he could cope with the high Andes and the Rockies as he's going through his journey. He smashed the world record, but give it to everybody. Why not everybody have the benefit of that? And whatever sport, whatever exercise, be it just walking to work or running the weekend jogger or the amateur cyclist. Let's give it to everybody, and it's available here. And very privileged to be here to be able to do that. With Circle, when we built the hospital and organised it, we really wanted the patient's experience to be much more. The patient's more relaxed when they come through, hospitals are stressor environments for everybody, not even staff as well as patients. So they're busy places, and we wanted to make Circle much more of a relaxed approach, much more personal approach. Let's greet the patient person. Let's show them where they need to be. We'll have the ability to go out into the waiting room and introduce ourselves to them in the waiting room, and bring them into the room. People will escort them and help them to find the directions if they need a diagnostic X-ray or whatever it is downstairs. Then they can come back up, and it's just more welcoming, and it's a more relaxed atmosphere or arena in a way, because with the deli in the middle as well, they can sit around and they can relax, have a coffee or a cup of tea.